So, sorry, blood pressure. So at the moment, I think that my dementia is causing my wife's blood pressure to get worse. Sorry, I had to put that in. No, seriousness aside, no, the joking aside, I'll start again. So fact, high blood pressure increases the risk of somebody getting dementia in later life. And the studies so far have concentrated on people in their 40s and anyone between 40 and 65 years old, which is the cut-off point for young onset dementia, calling. They've done studies associating or linking high blood pressure to vascular dementia. See, high blood pressure is to do with your arteries, you know, just blood go around your system and things like that. High blood pressure makes your blood vessels, the actual walls of the blood vessels go thicker and stiffer. Schoolboy thought just entered my head then, sorry. And it's called arterial. I'll spell it and print it up on the screen. All right, I can't say it because it's not there. So if you've got like high blood pressure and you're a bit overweight because you've got extra fatty things going around in your blood cells and things like that, they also block stuff. So I mean, basically your heart's going like 10 to the bloody dozen, isn't it, to get there. And what you have to remember is that the blood vessels inside your brain are minutely smaller than the ones going, like, for instance, up and down your careful what I say here, your arm, like, for instance, like, you know. And so what the potential for high blood pressure is to cause bleeds in the brain, you know, when one of these tiny micro blood vessels pops, like, you know, or decides to not want to be where it is anymore, and lets like the blood out into your brain. So that's a bleed. So that's called a stroke or an IRS or something. So I can't remember. It's an itchy-meanus attack, something like that. ITA, is it? Something, yeah. Yeah, we're recording, right? Okay. So and this can accumulate over many years. So it doesn't mean to say that you have some load of fatty cheese one night, suddenly that you're going to get dementia the next day. Like, you know, that it doesn't work that quick, like, you know, but it does work over like many years or decades even. So if you eat blue cheese and fatty stuff all through your days, like, you know, apart from all the cholesterol building up and that, which we'll cover in a minute, anything to give you high blood pressure, you know, which is upset, trauma, traumatic emotional issues sometimes cause high blood pressure. So your lifestyle, you know, just chill out, like, basically that helps you not get dementia. So those sort of things. I think we sort of got there in the end. I think you get the general gist of it, you know. So low blood pressure, low risk of dementia. High blood pressure, high risk of dementia later on. See you in the next